Yeah, here we are, man.
We are here. Attempt number two. Hopefully, Zoom will not fail us this time.
Yeah, thanks for coming back and virtually meeting me.
Yeah, for
Um,
sure. Thanks for having me.
yeah, man. So you are carving out a unique niche in the quote unquote psychedelic scene online, I guess you could say. I haven't really seen anybody else doing what you're doing or talking to the people that you're talking to. So that's why I wanted to come on here and, pick your brain a little bit and see what you know and see what's up in the business side of psychedelics.
Yeah.
But first, before we, dive down the rabbit hole of that, if you just want to give a little bit of how you kind of got on that track, how you became Brom on YouTube, and how
Yeah.
what your journey has been so far, and then we can get into it.
Well, before I became Brom on YouTube, I was Brom in the real world. That is actually my legal name. It's not short for anything. It's just Brom. That's
It's
it. So.
different. I never met anybody named Brom.
Yeah, it's a rare one. And that's why I don't use my last name generally, just because the first name is rare enough. And if you have my last
Mm.
name, you can find out everything you want to know about me. Although plenty of people already know my last name. It's on my email signature and everything. But yeah, Brom is short enough. So yeah, back before I was Brom on YouTube, I can sort of give you my background. So I sort of and how I sort of came to, first of all, caring about psychedelics, and second of all, caring about business, and then sort of the marriage of the two. I grew up in a military family. My dad was an officer in the army. We moved like all around the world, and as many people know, like military families, famously have we see the impacts of like post traumatic stress disorder and the other mental health challenges that people are faced with, and these mental health challenges obviously show up in all segments of society, but in the military they're often exacerbated by the intense situations that these soldiers are exposed to. And so I was kind of like aware of that stuff from an early age. And then later on, when my dad was later in his career and when he retired, he started a nonprofit foundation that was focused around like providing alternative sort of therapies to veterans that were dealing with not just mental disorders, but also physical disorders that they had gotten as a result of their service. And as a teenager, I sort of worked for that nonprofit that my dad ran. And so I got an even closer up view of the challenges that these guys were facing. And so I've always been aware of post-traumatic stress and the challenges of mental health. And one of the things that came along with that was seeing that a lot of the therapies that existed like didn't really do much. A lot of these guys, they got lots of help from the government, they got lots of help from nonprofits, and they still were, struggling. And it was really kind of sad. And it almost didn't seem like there was much that could be done. But then at some point, I think I was still a teenager, one of my cousins who had a pretty tough childhood, pretty traumatic childhood, she told me about how she had done underground MDMA therapy and how it had almost like transformed her outlook on the world. And that was really the first time that I became aware of psychedelics, which I think is a little bit different because lots of people are exposed to psychedelics from like a partying perspective, in college, and then maybe later on they figure out the spiritual aspect. But my first intro to even just like the term psychedelic was through this sort of like mental health lens. And so that was kind of interesting to me. And I remember my cousin was like, yeah, you should look up maps. And I like Googled maps and read about it. But then being an idiot, I didn't like stay on top of it, which I should have, because that was like over 10 years ago. And I could have been even earlier in this whole thing,
Mm-hmm.
But so I ended up going to school for finance, got a job at some hedge funds, and did lots of, I was a professional investor basically. And as many people in the financial world do, they get burnt out and they leave when they have their like mid or quarter life crisis, I guess. And it was the pandemic. I was about to turn 30, and I was like, man, I need to do something a little bit more meaningful with my life, maybe. So I left my hedge fund job in December, and I didn't really have a plan. It's not like my plan was to start a psychedelic YouTube channel, but over the 2020, which was when there were the first like companies to start coming out that were like publicly traded psychedelics companies. I had been sort of paying attention to those and, kind of like keeping an eye on them. And so after I left my job in December, I just sort of found myself using all my free time to like dig deep into these psychedelics companies. And like you said, I looked for other people that were talking about this stuff online, and there were a few people, but none of them really had like a real finance background, which is no disrespect to them. It's just like they didn't bring like any real level of like rigor that you would expect from, a professional investor. And so I was like, man, I think there's a void here. And So I just started sharing what I was learning by making YouTube videos and started posting them to Reddit, and people, liked them. And then eventually I was like, man, maybe I should like invite the CEOs of these companies on to interview them. And I didn't think any of them would even respond to my emails, but a couple of them did. Ronan Levy from Field Trip Health being the first one. I interviewed him, and the channel's grown from there. And I looked recently, it was March 1st when I uploaded the first one. So I haven't been doing this for that long, but yeah, I'm trying to just understand like the business side of psychedelics. Like you said, there are lots of people that talk about psychedelics online, but I think a lot of people that are involved in psychedelics don't necessarily understand what is happening in the industry, right? They're interested in like the spiritual and the like mental health benefits of psychedelics, which is great, but there's this whole entire like industry that's being built up around it, and I kind of want to understand it. So I'm running the YouTube channel. I recently launched a venture capital fund that's going to help invest in psychedelic startups. And the plan is to, of course, sort of have the media, the YouTube channel stuff, like feed the venture fund, raise awareness for it, bring deals to it, bring capital to it, and yeah, just try to use my sort of media platform plus my finance background to do the best that I can to like put money into promising startups in the psychedelic space.
That's awesome, man.
It's kind of long-winded answer. Sorry about that. But
No, that was good. That was very it was a good answer. It was a thorough answer. So where is the industry at now? Because obviously there's no mushroom dispensaries.
No.
It's not legal. Or maybe it is in Oregon, right?
Decriminalized, which
I thought like wasn't it legal for like therapeutic purposes?
So they passed something called Measure 109, which says that therapists will be allowed to use psychedelic mushrooms as part of their therapeutic practice, but that law hasn't actually gone into effect yet.
Oh, okay.
Right. It's sort of in the phase where like the law was passed, but the language of the law said once this passes, then we go into like a 2-year period where we actually figure out the rules around it.
Okay.
And so I think that's kind of where they're at.
Wow,
but yes, it will be. I think like therapists and some other healthcare practitioners will be allowed to give you mushrooms in Oregon. Yeah.
So do you see that as being like the first step to in the legalization process? It's kind of like aided trips, like you have a trip sitter pretty much.
So there are sort of two different angles that this is happening at. One is the legislative route, which you're talking about, which is like voters and Congress people and lawmakers passing laws that legalize or decriminalize substances like magic mushrooms and LSD. And that's what we saw in Oregon. But then there's more like the industry side, which is mostly focused on like pharmaceuticals, which is where rather than passing a law in the Senate or through Congress saying we're going to legalize these substances, they're taking a regulatory approach. They're going to the FDA and saying, hey, FDA, here are these clinical trials that we've run on psilocybin, LSD, whatever, DMT, whatever. And here's the data that shows that these substances are better than SSRIs or existing, antidepressants at treating something like depression or anxiety, and then getting those drugs FDA approved. Those two things can happen entirely independent of each other, right? So like the FDA approving a drug doesn't mean that it's like street legal, and a drug becoming street legal doesn't mean that doctors can prescribe it to you. They're sort of like two different pathways. Both are happening simultaneously. But we're in that first step. So like you said, we're seeing baby steps, states like Oregon, cities like Berkeley, California, decriminalizing, saying that we're not going to go after people that are possessing these substances. And then we're also seeing companies like Mind Medicine, Compass Pathways, Cybin running clinical trials on molecules like psilocybin for depression, anxiety, post-traumatic stress, et cetera. Yeah.
That's awesome, man. Yeah, I mean, this industry is going to be huge, right? Like if you have a little bit of foresight and you've tried these substances, and you have a little bit of like knowledge of, a little bit of knowledge of capitalism, you know that magic mushrooms, MDMA, I don't know, all these substances incorporated in the right way, if they do become unprohibited, it's going to be enormous, man. It really is, because there's so many benefits to it. There's so many.
It's going to be enormous. So one thing that's interesting is that the mental health industry, just in the US alone, I was looking this up the other day, we spend $280 billion a year on mental health and substance abuse combined in the US. pretty big number. This is just in the
Yeah.
US. This is per year. And the amazing thing is that a lot of the stuff that $280 billion is spent on, like, doesn't really work that well, man. So like, I think about 20 to $30 billion of that 280 goes to just antidepressants. And antidepressants, like, while they certainly do work for some people, they certainly don't work for everyone. I think 1 in 3 people are resistant to being treated by antidepressants. Like, they don't work for about a third of those people. For the remainder of those people that they do work for, they have like negative side effects like sexual dysfunction and weight gain, which are pretty ugly side effects, right? But there's like nothing else. This is like the technology. This is technology that's from, the 80s and 90s. That's when SSRIs were invented, and it's like the best that we have. And so people are still spending money on it because there's no other option. But it's like the treatments kind of suck. And so if you can just get in there with something that's better, which, many people would say psychedelics are, you're going to be able to make a lot of money. Of course, the challenge is that, substances like psilocybin and LSD, they're substances that, well, psilocybin is naturally occurring, and LSD was invented in, I think, 1943. So the patent on that is long expired. So the question is anyone going to actually be able to make any money off of the molecules themselves? And, this is why you see companies like Compass Pathways doing things that lots of psychedelic enthusiasts, including myself, really find disgusting, like trying to patent some of the fundamental attributes of psychedelic therapy, like the therapist holding the patient's hand, having a room where the therapy is conducted that's painted with soothing colors. Like, this is shit that people have been doing forever, like holding someone's hand while they're tripping, or like being in a room that's like painted like a soft color. And they're trying to patent that shit, which I don't think those patents are going to hold. They're not going to, I don't think those patents will succeed, but it's still ridiculous that they're trying in it.
Yeah.
Even if they don't succeed, it gives a bad name to the industry and a bad name to the capitalistic side of things, which I think have the potential to do a lot of good in the industry. But people like this are coming out and making all of us look like assholes, which is unfortunate.
And especially whoever that company was looks like an asshole for trying to do that. Like, you spent time trying to do that. Like, they literally that's actually a thing. They tried to patent hand holding.
Yeah, dude, if you just Google the name of the company is Compass Pathways, and in all likelihood, they will be the first company to get FDA authorization on psilocybin because they started before any other for-profit company. They're in phase 2 clinical trials right now of psilocybin for major depressive disorder. And if you just Google Compass Pathway patent, you will find a Vice article and many other news outlets sort of picked up on this. So the patent included a bunch of shit, and some of it was things that were unique to Compass, but it also included hand holding, the room being painted with a soft color, the patient sitting on soft furniture, and the patient listening to like soothing music while tripping. It's like sitting on the couch and listening to music. They're like they like literally put that in the patent. It's so stupid.
That's very, very stupid.
Yeah. Yeah. And like you said, they like paid a lawyer to like put this together and like submit it to the patent office, right?
Yeah. Someone put their processing power in their mind to that.
Yeah.
That's crazy.
Mm-hmm. But that said, so that's sort of the dark side of the industry. But I think there's a lot of potential good that, corporations can do in this space. So for one, like, I think that there's not going to be let me rephrase that. So a lot of companies to date have focused on running these clinical trials on like existing molecules, psilocybin, LSD. But there's a whole other like category of business that is these services that are going to support the therapy, like the psilocybin and LSD therapy. So like, you're going to need clinics to do these substances in. You're going to need trained therapists to like administer them, right? The research shows that that psychedelics, if you're trying to use them as tools for changes, for like real change in your mental state, it's not enough to just do the drug. You need the therapist to like help you integrate the experience, right?
Yeah. Mm-hmm.
So you need those people to be trained. You need places for them to do that. You need to figure out how to like manufacture these substances at scale, right? Like, up until now, no one has really mass manufactured psilocybin or LSD or other psychedelics. Like, it just hasn't been done. It's usually done in small batches. So someone's going to need to figure out how to manufacture this stuff at scale. There may be alternative delivery systems, like maybe ingesting psilocybin by eating a mushroom is not the optimal way. Maybe you can cut the trip time down by like smoking it, or by like having some sort of transdermal skin patch or something like that.
That's probably been tried before.
Well, it's been tried by individual enthusiasts that maybe didn't have like, real research labs and like, real experienced scientific teams. But I've actually met people that are working on this stuff that have like real backgrounds in like engineering and are getting some pretty interesting results. And of course,
Yeah.
the promise of an alternative delivery system is that you could potentially cut down on some of the negative effects of taking it in like a pill form. So
Mm.
one of the downsides of like psilocybin right now, for example, is that, as you probably know, it takes like 90 minutes to kick in, sometimes shorter,
Yeah.
but it takes like some time to kick in, right? So if you're like a busy parent, like you need that experience to be shorter. So if you can like eliminate that like initial 60 to 90-minute waiting period by just getting it directly into the bloodstream in some other way,
Yeah.
then maybe you've made the therapy more accessible to people that have like busy schedules, which is the majority of people, right? Like not all of us are just like, single guys that can like take a day off to just like go to hyperspace and come back. A big chunk of the world has like very tight schedules and they need to be in and out, unfortunately, but that's kind of how it is. So, those products and services, alternative delivery systems are huge. And then one of the things that I'm most excited about besides that are the novel psychedelic molecules. So, people don't really think about this, but LSD and MDMA were invented by like chemists and labs, right? Like they're not naturally occurring things. And so we know that like man-made synthetic psychedelics can be very powerful. And the idea that like LSD and MDMA are sort of the final form, I think is kind of silly, right? Like those guys, Hoffman and whoever invented MDMA invented them like decades ago without like the aid of modern technology. Imagine the types of psychedelics we could invent now with like all the compute power and the knowledge of the brain that we have today. So I think you could see psychedelics that maybe don't take maybe take only 30 minutes to act, maybe have like a much reduced chance of a bad trip. Maybe they don't have a hallucinogenic effect at all, but you still get the mental health benefits. Like now that maybe doesn't excite like someone who's really into, tripping balls for a long time, but if it can still help people, which is kind of the goal of the mental health industry.
That's interesting.
So yeah,
that's very probable.
Yeah, I think so. So that's one of those novel psychedelic molecules. That's a major focus for the fund that I'm starting. It's like investing in those research companies that are doing the research on that. There's also some evidence that the existing psychedelics are maybe not as safe as we'd like them to be. So psilocybin in particular, it's not like people are like dying after taking psilocybin, but there is some studies that show that if you use it repeatedly over long periods of time, which some people that do microdosing do, it can potentially damage heart valves. And so, whether like how true that is and who's at risk for that is kind of an open question, but the FDA is aware of this. And this is why the FDA has not done any like real clinical trials on microdosing yet. And it's also why the FDA in most of the clinical trials limits the number of psilocybin sessions to 3, because they think doing more than that might be like, possibly dangerous. And it's also the reason why the FDA won't allow people that have heart conditions to participate in these trials. So not trying to like fear monger about psilocybin. I think psilocybin is mostly safe for most people, but if there is a risk to a certain segment of the population, if you can create like a drug that doesn't have that negative side effect of, putting pressure on the heart valves, then you're able to reach, more people. And that's the kind of stuff that I think capitalism can do a good job at. Yeah.
Yeah. That's interesting. If you could create the perfect psychedelic in the laboratory, what would it be to you? Like, what would be like the perfect magic pill?
Well, dude, I don't know that it's necessarily, I'll answer your question in sort of a way that's maybe different than what you're expecting, but the point is that it needs to be customized for the patient, right? Like maybe not everyone has that heart risk. So they need a specific psychedelic that like, will be sensitive to the 5-HT2B receptors on the heart valves. There are actually some, I took a note of the name of this company. I should pull it up real quick. But there's actually a company right now that is looking at a genetic test. So they take a little like, cheek swab, and they can tell based on your DNA how different psychedelics are going to affect you in different ways. Because as we know, because as you know, dude, if you take mushrooms, then your friend takes mushrooms, your experiences are not necessarily the same. Some people are more or less tolerant. It's the same thing with marijuana, right? Like anytime I smoke any weed, I think I'm going to die. Like some people have a totally different experience. And so this company, I got these notes here. Should have pulled that up. It's called Halogen, I believe. And they're working on a genetic test that can look at like your ketamine metabolism. It can look at the risk factors that you have for psychotic breaks. Because, some people that are predisposed to like schizophrenia can have that triggered by like high doses of, LSD. It can also look at your serotonin response. And so they can actually customize like the dose of the psychedelic for you based on your DNA. So the idea of like, what's the perfect psychedelic for you? I think within 10, 20 years, we may actually be able to answer that question with a test and, give you the right blend of molecules at the right dosages to create an experience that's like pleasant for everyone.
That's trippy.
Yeah, it is super trippy.
That said, we just had to pick the mushrooms, kids. We didn't know what you were going to do.
You ate the bag, and hoped for the best, which, I think there's something nice about that sense of adventure. But, for the general population, I don't know that everyone has that level of risk tolerance. So,
yeah, no, definitely not. Yeah. If you want to actually approach it with a sophisticated, intelligent manner, I never even thought of anything like that, like a personalized, customized psychedelic experience for your DNA. Mm-hmm. That's pretty far out.
It really is. And, it's coming. I think if you just Google, I'm pretty sure it's Halogen, Halugen. You should find them. I should probably.
Halogen.
Halogen. That's it right there. Halugen. Discover your reaction to psychedelics. They have the page right there. And I'm not like affiliated with this company. I haven't really done deep research into it, and who knows if their version of this sort of testing will be the one that actually works in the long run. But the idea is sound, and I think we all know that different people react to psychedelics in different ways. So yeah, there it is. So I think the idea is right, even if Halogen doesn't end up being the people to produce the final ultimate test.
That's pretty cool, man. It's an app.
Yeah, I think you got like order it from your app, and then you still have to like swab your, the inside of your cheek with like a Q-tip and stick it into it.
So this is the thing right now. You can do this right now. $90 free shipping.
Yeah, dude, $90. You can do it. This is not, and I think that the things they test for are pretty simple. Like, I think they mentioned ketamine metabolism. So if you're doing ketamine, it can tell you like, you should do more or less depending on how intense your ketamine metabolism is. They look at your serotonin response, which most psychedelics function primarily by agonizing, the 5-HT2A receptors, which are a class of serotonin receptors. So depending on your body's serotonin response, you're going to have a different level of sensitivity to psychedelics. So anyway, man, cool. Yeah, I think that, in the next couple of years, we'll probably see a lot more research go into this sort of thing. And then the next step, of course, is like, I think that Halogen, as far as I know, they just sort of give you some guidelines like, hey, maybe do like a smaller dose than a normal person would, or hey, maybe you're going to need a bigger dose. But as time goes on, you could imagine a system that really says like, oh, here's specifically exactly how much of each substance you should take. And then maybe, many, many years in the future, it'll say, here's actually a custom molecule that we just like 3D printed and like gave you a little pill right here.
That's crazy. Wow.
Yeah. So the future, there's something amazing about the plants that have been here for 2,000 years. But there's also something amazing about like this whole new world of like synthetic stuff.
Yeah. There's something amazing about human ingenuity as well.
Mm-hmm. Like, have you read the book called Pikal? Are you aware of that book?
No.
Oh, dude, you got to look up Pikal, man. So, it's P-I-K. Damn it, I always forget. Hang on.
P-I-K-A-L?
P-I-K-H-A-L.
Okay.
Or P-I-H-K-A-L. God damn it.
Oh, yeah. By Alexander Shulgin. Oh, he wrote, what did he write? I know Alex. Oh, yeah, I know Alexander Shulgin. Okay.
Yeah, so he was a chemist back in Berkeley, and dude, the book Pikal basically goes into his research. He created like over 200 different psychedelic molecules like in his basement and tested them on himself. And
wow.
and this is like, again, like back before computers and stuff, right? This guy was just a genius chemist, and he was able to construct like 200 different molecules that all had different psychedelic effects. And the book documents like exactly how he made them, and then has like trip reports of him and his wife and their friends like doing these drugs.
Here they are, I think, the essential amphetamines.
And so you got to imagine, like, most people just know, LSD, MDMA, blah, blah, blah. But there are literally hundreds of potential molecules that are psychedelic in some way.
Look at that. So did he create these?
Yeah, he synthesized these in his lab.
Oh my! And he tried all of them too.
And you can read the book which describes it. And what's interesting about it is that it's not just like a boring science book. Like he'll lay out the exact chemical formulas and then he'll lay out like how he synthesized them, like the laboratory steps.
Wow.
And then like the next paragraph will be describing like what it was like to have sex with his wife while on the substance.
Oh my God.
Yeah. I mean, it's like,
this guy's a legend.
He is. And he lived to be like 90 years old or so. I mean, it's insane.
Yeah. Didn't he just die not that long ago?
Yeah. He just died pretty recently.
Wow.
So yeah, I mean, this idea of, creating synthetic compounds is not new. It goes back a long time, but it's just that, it's been something that we couldn't really do because of regulations up until recently. One of the funny things about that guy Shulgin was that he worked for the DEA.
Wow.
Yeah. Like the DEA hired him to do to create drug tests for them. And I think at one point they ended up like raiding his house after realizing that he was like, in addition to working for them, was also like creating his own batch of like hallucinogenic drugs.
That's awesome, dude.
Yeah, he's a fucking legend.
Wow. It's all chemicals. It's all just literally molecules in our brain that act as like keys. And you put the key into the door and you open up the doors of perception. And that's all it is, dude. It's just like a simple... And these chemists, obviously, that know way more about chemical structure and compounds than I do, they know the exact way to do it. That's crazy.
Well, I don't know that they know the exact way. I think a lot of it is trial and error. And that's why,
they know more than I do.
They know more than we do, but they have an idea of like what might hit the receptors in the right way. But there's still so much that we don't know. Even a basic thing like a psilocybin mushroom. All psilocybin mushrooms have psilocybin, and the structure of the psilocybin is like identical in every mushroom. But people that are, have done a lot of different mushrooms will tell you that like different strains of psilocybin mushrooms have different effects. Well, like why? If psilocybin is the same, like why do these different types of mushrooms have different effects? Well, there must be either these guys are just like fooling themselves and, making it up, or there's other shit in the mushrooms that we haven't like documented yet that have some interplay with the brain. So I think even when it comes to just researching psilocybin mushrooms, there's a lot that we don't know.
Yeah. And that's why we need to legalize these things, because there's so much we don't know.
There's a ton that we don't know. And, the crisis, the mental health crisis is like pretty fucking serious. And, people need help. People need to get off SSRIs. People need to stop killing themselves. I did this whole deep dive into the statistics behind the mental health crisis in the US, as I was preparing to launch this fund, because I wanted to like present to investors like, hey, look at how bad all this shit is. And, dude, it's like so sad. Have you ever heard the term deaths of despair?
No.
The deaths of despair is this like catch-all phrase that the CDC uses to categorize deaths that happen when your life is like not going too hot. So it includes like drug overdoses, suicides. If you die from like fucking up your liver because you're an alcoholic, that's like counted as like deaths of despair. It's just like, imagine all the bad ways you can die. Like that's categorized as deaths of despair. And like the rate of deaths of despair has doubled in like the last 30 years.
I don't know about that. Wow.
Yeah. And, I think it's like 1 in 5 people are like currently diagnosed with some sort of mental illness. And that includes everything from, depression to schizophrenia. 1 in 6 people are taking some sort of antipsychotic drug. And over the course of your lifetime, you have a 50% chance of being diagnosed with some sort of mental issue at some point in your life. So it's like a real thing that affects everyone, like who doesn't know someone who's like severely depressed or has PTSD or something. It's like, it's a real thing, man. And we don't have good ways to treat these people, and psychedelics offer a solution.
Yeah, they are the solution. What we have right now isn't a solution. It's just it's a treatment. Like you said, it's just something that treats it, but it doesn't heal it. It's just something that is kind of like mitigates symptoms. And then, you can re-up and get some more from the drug dealer in the lab coat whenever you want. But it's not like, that's the thing too, is I don't know how is this going to go with the idea of capitalism, right? Because it's essentially what it is now. It's like, they give out these drugs like drug dealers. You just like, if you want some more, come back in, a month, whenever your prescription is ready, and you can get some more. But with, things like psilocybin and any other substance like that, you don't necessarily have to go for repeated uses. It can just be like a 1-time, 2-time thing, and then you're good to go. So like the profit, it's not really profit driven in the same sense as SSRIs are. So the industry is going to be something that's completely different
Yeah.
than what
Yeah.
we have set up right now.
Right. It's not, there's not as much like built in recurring revenue. It's not like you go every single day. Right.
Yeah.
So I think there are a couple counter arguments to that. So on one level, you are right. Like you do psilocybin, you don't need to do it again next month. Right. But people do often do it again. Most of the studies that we've run are usually done on the time scale of like a year to 18 months. And, as someone who's done, psilocybin many times, like the effect does wear off eventually. And so, I think people will probably come back at least every year, every 2 years, every 3 years, something like that. Maybe not, but I think there's like a natural inclination to want to go back to that at some point. Also, I think that the smart providers are understand the problem that you just sort of pointed out. And so their business models are not going to be solely around providing, psilocybin. It's going to be around providing therapy and mental health services that include psilocybin. So like you might only do that psilocybin once every 5 years, but you still might talk to your therapist and do meditation through their app and, maybe go to counseling when you've had like a hard time in your relationship on a much more regular schedule. So I think that like right now, because psychedelics are so new to like at least the business world and the mental health world, they're sort of like the psychedelic industry. That's kind of how we think about it. But I think in 10 years, you're just going to think about it as like part of the mental health industry. It's not going to be like, oh, there's like a weird psychedelic guy over here and then like a regular therapist over here. I think like every therapist will be able to offer some sort of psychedelic services when needed.
Yeah.
I think that's kind of the idea. And then of course, don't forget about microdosing. So some people do use psychedelics on a regular basis, and those are the people that are into microdosing.
Yeah.
And I think with microdosing, there's huge business potential there. Of course, the studies have to prove that microdosing works. I know a lot of people swear by microdosing. The research is a little bit mixed. Like the high doses of psilocybin, the macro doses, the data is like all in agreement that it works very well at treating depression. The data on microdosing is a little bit mixed. Like some of the studies suggest that it's good, some studies suggest that it's bad. But I think over time people will find the right way to microdose, and when they do that, there's going to be a huge business opportunity in providing like lab grade psychedelic substances that are weighed out exactly, because one of the problems with microdosing is if you take a little bit too much, all of a sudden you're like tripping and not actually microdosing. Mm-hmm. And then you have to like drive to work, which is a problem. So having like that lab pharmaceutical precision dosing of like a microdosing product, I think might end up being one of the most commercially successful psychedelic businesses out there.
Yeah. See, that's where it gets interesting to me, because like I almost see like two different industries. Like one industry is going to be like the therapeutic. I guess it's like this. You got the microdosing industry, and then you got the macrodosing industry. And the macrodosing I see as dealing with the therapy, meditation, integration. And then I could see the microdosing industry also like just giving out, let's say, like the small doses where people have it with their coffee or something in the morning. And I don't think you necessarily need therapeutic sessions for that.
No,
it's like how do you blend those two into one? Like, I don't know. Do you think there's going to be both at the same time? Like you're going to have people able to sell at small doses, and then you're also going to have therapy sessions at the same time for other people?
Well, the therapy stuff is what's going to be approved first. So if you want like a more concrete timeline, I would say 2023. So, 2 years from now, we're going to start. That's when Oregon's law is going to take effect, and therapists are going to be able to give this stuff to people during therapy sessions. That's also likely when MAPS's MDMA for post-traumatic stress disorder protocol is going to be approved by the FDA. And that's obviously a macro dose type protocol. Mm-hmm. Shortly after that, 2024, 2025, that's when I think Compass Pathways, which is the guys that were trying to patent the soft colors on the walls and the soft music, that's when they're going to get psilocybin approved through the FDA as a macrodose therapy for depression. In terms of microdose stuff, if that comes through the FDA, that's going to take a lot longer because there are currently no phase 2 trials for microdosing that I'm aware of anyway. It could, I think in terms of like legalization, that's something that may happen over time. But I think that what we're going to see instead of like full on legalization is more like this decriminalization thing where for those the listeners that don't really know the difference, like legalization is you can open up like a store and sell mushrooms. Decriminalization is like you can't sell them at a store, but if you get pulled over by a cop and you have mushrooms in your car, you're not supposed to get in trouble for the mushrooms, but you can't like sell them on the street in public, right? It kind of just means no one gets arrested. I think that most of these states are leaning more towards decriminalization rather than legalization. And a large segment of the population is not going to be comfortable like going to a drug dealer under decriminalization, like just because you have to like you have to find them. It's like still kind of sketchy. It's like gray market instead of, black market, but it's still a little sketchy. And I don't think we're going to see like full on legalization, like where you can buy mushrooms in a dispensary for like a long time. I think that as fast as this is changing, the public is just like not ready for that yet. So I don't think we see that for at least 5-10 years. So, in the immediate future, I think that's where I think it's going to be based on therapeutic macrodoses done under the supervision of a therapist or doctor.
Yeah. Yeah. I see that too. That makes sense. I mean, yeah. Can you imagine, like a world where you can just go down to a place like a dispensary and you can pick up some psilocybin, you get some DMT, you can get some mescaline, like whatever you want, man. Just pick, just like a dispensary, like weed. Cause like you can get some really powerful substances at a cannabis dispensary where you can, have some really powerful experiences. So, it's funny because people think weed, it's like cigarettes and alcohol, it's just something you do to have fun. But, try eating like 100 milligram edible, 500 milligram edible and see how much fun you have,
Jesus.
And compare that to a mushroom trip. It's very similar, but yet they're selling this to people. Maybe they'll have like certain, like, how they have medical programs where you get your medical card. Maybe it would be something like that,
So yeah, I think the medical card may happen first. I think in Canada there may be. I'm certainly no expert on what's happening legally in Canada, but my understanding is that they're experimenting with some programs like that. There's this thing called compassionate use trials, which is if you have like a group of people that are suffering intensely, you're allowed to try like more experimental therapies. And I know in Canada they approved compassionate use for, I think it's like cancer patients that have terminal cancer. So like in Canada, if you have terminal cancer, you can like trip on mushrooms to help ease the pain of dying, knowing that you're dying. And I think that's a start, right? You start there and then you start expanding that to like people that just have generic PTSD, generic depression.
Mm-hmm. I talked to Thomas Hartle. He was one of the first ones in Canada, if anyone's interested.
Yeah.
Search that. Yeah, he was it was a really good interview, and he's a great guy too. But I found out and I saw a news article that he was one of the first dudes that did it, and hit him up on Facebook if he wanted to talk, and we had a good talk. But
that's awesome.
He was the way he explains the process is very thorough, very precise, and he had a lot of good insights about life too. So if anyone's interested, they can go check that one out.
I think I'm gonna watch that. Thomas Hartle, you said?
Yeah, Thomas Hartle. It's like, I think it's number 16, 15, like that. It was really early one that I did. Pretty cool though. He's a great guy. But he has other interviews too with other people. So just check him out. Cool guy.
Yeah. Yeah. I think one of the other things that needs to happen before we get to like, medical programs is there just needs to be more data that supports like the safety of this kind of stuff. For example, like I don't want to like fearmonger. I don't think that like most people are going to get hurt from psychedelics, but like you talk about psychedelics treating people with depression. Well, there's like a whole bunch of like mothers that are like nursing mothers that have postpartum depression. Like, can they take psilocybin? Is it going to like fuck with their breast milk or like hurt their baby? You know what I mean? There are like a lot of questions that need to be answered. And once those studies are done, then, maybe people will be more open to it.
Yeah.
But I don't know, man, it's happening. I don't know what's going on in Massachusetts where you are, but like here in California, there have been some bills put forward to decriminalize/legalize this stuff, and they're making their way through the legislative bodies in the state government. So it's certainly possible that we see these things legal sooner than I might expect.
Yeah, definitely decriminalize. It's going to be like snowball effect, domino effect. California is always the first one to do it.
Yeah.
And then Massachusetts has some groups, but there's nothing in like legislation right now. But domino effect, like I said.
And it's interesting to see how even under decriminalization, people figure out ways to sell this stuff. Like, have you heard about the psilocybin churches in Oakland?
Yeah, I talked to the dude that got busted.
Oh, really?
Yeah, Dave Hodges, and that was a really good interview too.
Shit.
So if you want to check that one out.
So what happened to him?
Well, he got arrested, but he's awaiting trial. At least he was
Oh
in the
shit.
in the interview that I was doing. He was awaiting trial. I don't know how he's doing. I haven't talked to him in a long time. But shout out Dave Hodges. He's a good dude. I like that guy. But yeah, man, he was just they were just showing themselves as a cannabis and mushroom church, and I don't know what they did there. I don't know what they were preaching or what what was going on, but he got busted. And some people say it's because he was evading taxes, but he
Mm.
said it wasn't. And I don't know what they were doing. I'm not going to speak for the guy, but he was a cool guy. I talked to him a little bit, and yeah, I don't I think he's trying to go to establish the church in, is it Oregon? Was where they decriminalized it?
Yeah, Oregon's probably the best place to do something like that.
Yeah, I think that's what because this was before the measure passed. So I think he said if it passed, he was going to try and move the whole thing to Oregon. So maybe that's what he's doing right now. Like I said, I have no clue if he's listening. Shout out Dave Hodges.
Yeah, I knew a couple people down here that were involved in like mushroom cultivation, and literally like I remember seeing literally like the day after the 2020 election when that Oregon measure passed, they were like posting on Instagram like, here's a picture of me packing up my shit to move to Oregon. Like it took them like all of 24 hours to decide to move up there.
Yeah, I mean it's a no brainer if that's what you do for a good base of your income. Like you
Yeah.
know, it's crazy, man. Like I mean, I feel like we're not moving fast enough. Even though like it is when you say 5 to 10 years, I'm like, whoa, that's kind of soon. But I mean, every day that goes by, there's more people that get incarcerated. There's more people that are suffering because of this. There's more people that are literally killing themselves because of the mental health epidemic that we live in, you know? And it just pains me, man. Every day that goes by that we don't have access to these things and people don't have the right education about these things. Um, it just pains me. It really does, man, because you know, and I know how beneficial these are, like truly beneficial these things are to our whole being. And it sucks that we're still living under the iron curtain of the drug war, you know, because that's what it is. It's like we're still from decades past, we're still living under the legislation that was brought about by what was it, Richard Nixon, and we're still suffering from that, dude. It sucks, and it's such a long process to
Mhm.
change our ways, like to actually change the laws. It takes so much time, but that's because it's up to us. Like, would it really take that much time if, like, let's say the people that are in power really wanted to change this, right? Tomorrow, say, would it really take that much time? I don't think it would take that much time. It's just that nobody's paying attention that are politicians. And AOC tried to um what was it? There was a bill that had an amendment. I actually have it up right here.
Yeah, I
It
saw
was
I saw that news story. She proposed some amendment to something.
Yeah, it was an amendment to, this is the quote, allow United States researchers to study and examine the potential impacts of several Schedule 1 drugs, such as MDMA, psilocybin, and or ibogaine, that have been shown to be effective in treating critical diseases. And it got voted down um, from a yay vote of 140 and a nay vote of 285. Like 285 of our representatives thought that was a bad idea.
Yeah.
Like, come on, man. Like, what?
Yeah.
It's
I
crazy.
mean,
They're holding
I
back
don't know
progress.
the language exactly that was in the bill, but yeah, that seems it's pretty fucked up. And this is why it's important. One of the things that really frustrates me as like, a young person in this country is like seeing how many people I know that like talk about this kind of shit and are very interested in politics that like still at the same time like don't vote because they think their vote doesn't count.
Yeah, right.
And it's like this kind of shit, you actually can have a say in, man. Like voting the person that you vote for as your congressperson, as your senator, that stuff does matter. So I think that, if you're someone that like cares about this stuff, like if you have no other issue that you care about, but you care about this, like, this should be a reason to like incentivize you to vote. So
Yeah.
do vote, especially in those like local elections, because a lot of this stuff, like cannabis still isn't legal federally, right? The
Hmm.
only way that we've made the progress that we've made is because of like local elections, voting in your city council elections to like vote in city council people that are willing to like decriminalize the stuff at the city level. This is where it started. But before Portland decriminalized it at the state level, there were multiple cities in California, Denver, Michigan, and Oregon that had decriminalized it at the city level. So like getting involved in those local politics is one of the best things that you can do. to, actually like affect this change. And
Yeah,
so
for
I would
sure.
encourage everyone to do that. Look up like decriminalized nature maps. Those are like nonprofits that are, advocating for this kind of stuff, and, either donate your time or your money to them, and like tell your friends, because
No,
this is the kind of thing that it can be changed. As slow and as fucked up as it is, it can be changed. I truly believe that.
for
And it's
sure.
like, it's
Yeah.
kind of it's in our hands if to do it.
Yeah, it's becoming political now, which is crazy. It's not really the turn on, tune in, drop out era anymore. It's actually like becoming part of our political ideologies. Well, I mean, or it's trying to be at least. But we'll get
Yeah.
there. It'll
Well,
take time.
one of the interesting things is like, about this is that it is political, but at the same time, the I guess it's like the good and the bad thing about mental health is that like it affects everyone negatively, man. And like, MAPS, when they were trying to get permission to do their like psychedelic studies, Rick Doblin was, I think, like having a hard time, getting people to like take him seriously. And then he started pitching it as, we're going to help soldiers with PTSD. And
Hmm.
all, in the United States, like anytime you put anything next to like soldiers, it's like, oh, this is good now. You can take like the worst thing in the world and say like, it's for the troops. And all of a sudden it's like a good thing. So as soon as it was pitched like, oh, this is going to help the troops, now all of a sudden you get people from both sides of the aisle, whether they're Republican, Democrat, Libertarian, whatever, they're all invested in like helping the troops. Right. And
Yep.
so, he was able to, raise support that way. And, it is changing, man. Like I remember just like probably 5 years ago, my grandparents, they're, white people in their 70s. So they have the viewpoints of white people in their 70s. Right. And even like 5 years ago, if you like smoked a joint or whatever, they're like, weeds for like, lazy shitheads, blah, blah, blah. Now, both my grandparents put like, cannabis drops in their coffee every morning.
It's
And
amazing.
like they can't live without it. Right.
Mhm.
So even for people who, seem like they're past that point of changing, I think can change when they are shown the benefits. And I think we're going to see that with psychedelics too. Like, I don't know if you saw just a couple weeks ago, Good Housekeeping magazine, which is like a magazine that is targeted at women in like their 50s, 60s, and 70s that are like in the Midwest, had like this multi-page article on psychedelics to treat depression and anxiety.
Really? Wow.
Yeah,
That's
fucking
awesome.
good. I mean, dude, Good Housekeeping, literally, like my grandma had a stack of those in her bathroom, like as a kid growing up. This is not
See if I
this
can
is
find
not
that
like
real
a
quick.
magazine that I would read. And yeah, Good Housekeeping posted this huge expose on psychedelics because, dude, one of the stats that I uncovered when I was researching the mental health crisis was that the number one consumer of antidepressants and anti-anxiety meds are women above the age of 55.
Oh,
So,
yeah, that makes sense.
yeah, I mean, it's like, yeah. So a lot of times there's this like perception of mental health is like, oh, it's all these like young people that like care about their mental health and shit. And, but no, it's actually, like people that are older have these problems too. And so, yeah, there's the Good Housekeeping article. So it's like a long ass article that has like quotes from scientific researchers, and
Yeah.
it's in Good Housekeeping. I still can't
Yeah.
believe it. It like blows my mind whenever I see that.
What a time to be alive.
Yeah.
Well, this article probably, yeah, don't try this at home.
you got to do it with a therapist, bro.
Experts caution against using these drugs at parties, concerts, or even at home.
Mhm.
Experts. What kind of experts are those? Come
Dude,
on.
I think the guy that they well, hey man, they got it. One of the guys that they interviewed for that, I'm pretty sure it's Matthew Johnson. I could be wrong, so don't come at me, but Matthew Johnson, he's been like researching psychedelics for almost his whole career. And I don't think he's ever actually done psychedelics.
Wow. Okay.
Because I want, and I'm like
How?
90%
How does
sure
that
this
work?
is I'm like
How does that
90% sure
happen?
it's Matthew Johnson, not someone else. So I'm sorry if I got that wrong. But yeah, the whole thing is that because this stuff is was so stigmatized, it's like if he went out and told people at academic conferences, hey, I've tried these things, then people say, oh, well, you're obviously biased because you tried them and you like them, right? And so now you're going to like bias your studies. So he feels like in order to really be taken seriously, he has to stay away from it. But
Maybe he's just saying that.
he could just be saying that. I mean, who the fuck knows?
Yeah. I mean, because like, how do you not get curious? You're
Yeah.
researching these. How many years you said?
I mean, his whole career, the guy's
So a long time, right?
Yeah.
And you don't get curious, eat one mushroom or two just to see what it's like, what all the fuss is about. Like, come on, man. He's got to be just saying that.
It's I don't know, man. I mean, it's hard to say.
He's gotta just be saying that, man. Because like, if he is, that's actually true. Like, he works for Maps. He's been researching this probably longer than I've been alive, and
Mhm.
he's never gotten curious to
Yeah.
just like, I don't know. That just blows my mind. If that's true, shout out Matthew Johnson for his fortitude and his being and staying true to his discipline. That's crazy.
Yeah, it's silly, and you know, I think that that is common amongst like, but you got to think, man, there was a time probably even like 20 years ago where if you were a young college professor, like you just got your PhD and you're starting off in your research career, if you even suggested that you were going to focus on researching psychedelics, you probably couldn't get a job. No one would take you seriously, right?
Yeah.
And so the only way to present it is like, I'm going to research their effects on other people. I'm certainly not going to touch them myself. And then like,
Hmm.
you know, but
It
now I
makes
think
sense. Yeah.
maybe this is now things are changing a little bit.
Yeah.
Yeah.
Because you know what's crazy is like those people that would have those opinions like that are ones that never tried it. You
Right.
know,
Right.
that's the problem is we have to just get rid of the stigma. And once the stigma goes away, then we can actually, move forward and incorporate this into our society how it should be. But we're getting
Yeah.
there. Like you said, if it's in good housekeeping, we're getting there. That's for sure.
I mean, you can't get any more mainstream than good housekeeping. It's,
Well, that's
but
the thing
I,
too, is it's mainstream. Like it is, like it's on. They did a 60 Minutes show about it. What else? I've seen a lot of news articles. Like actually, like actual reputable news articles have reported on it, but yet we're still not there. You know?
well, I mean, yeah, the news articles are doing great at changing, you know, the public's mind, but it's not just the public, right? It's like the FDA is going to go off the data that they're given by these clinical trials. The lawmakers are only going to, a lot of these lawmakers have been, you know, maybe they're getting money from drug companies that don't want to see these things get approved. Although I
Yeah.
think that most drug companies are not as anti-psychedelic as many people might think. I think the big pharma companies are actually quite interested in this stuff.
Mm.
Um, but it just takes time, and you know, it'll happen. I think that one interesting place to look if you want to see a little glimpse of the future is at ketamine clinics. Have you done any studies of the ketamine clinic industry?
Um, Not really. I've talked to some people. I talked to one girl who is going to open one. She's a
Mm.
psychologist and she was planning on open one, a ketamine clinic in the US, I think. But yeah, I'd never really done much research. But what's interesting to me is that it's like, isn't it kind of legal?
Yeah. So the way that it works is that ketamine is actually used. It has like a medical purpose. It's an anesthetic, right?
Hmm.
Ketamine was invented a long time ago. It was the primary anesthetic used in battlefield war, like in Vietnam. People were getting injected with ketamine all the time if they got shot or whatever. They still use it a lot in veterinary medicine. So, like if you've ever taken your dog to get a surgery, they probably shot him up with ketamine. And the FDA has this thing called off-label use. So if there's a drug that exists for some purpose that is like, you know, legal or FDA approved for some purpose, doctors can prescribe it off-label for something else. So because ketamine has that legal approved use as an anesthetic, doctors are able to actually prescribe it for other things. And
Hmm.
that's why doctors are able to prescribe ketamine for depression. And so yeah, you look at this ketamine clinic industry, and I think that that is sort of like what, you know, the psychedelic industry is going to look like in the future. And we we see a lot of like doctors that have had offices for a long time that are just like offering ketamine to their patients, but we're also seeing chains of clinics that are specifically designed to be like optimal trip rooms for ketamine. Like, have you heard of the company called Field Trip Health?
Hmm.
Yeah. So if you like look at pictures of their clinics, dude, they look amazing. It's like the coolest fucking trip rooms that you can imagine.
All right, I gotta pull that one
And
up.
their whole point is like, yeah, come and do ketamine here. And
It's a good vibe.
obviously, yeah, it's supposed to be a good vibe. They have like 10 locations all across the US and Canada. And one thing that's interesting about them is that they've recently opened a ketamine clinic in Amsterdam. But the interesting thing about that is that in Amsterdam, psilocybin is legal. So they're actually offering psilocybin assisted therapy at their location in Amsterdam.
Oh,
So
that's awesome.
they're kind of like one of the first like US, you know, Canadian companies that is actually doing psilocybin therapy for real, just at their one location in Amsterdam. But obviously, those experiences at that clinic in Amsterdam are going to sort of give them a base of knowledge and when it comes time for that to be legal in the US, then I'm sure they'll have a bit of an advantage because they've been doing it in Amsterdam this whole time, which is kind of cool.
Yeah, that's pretty cool, man.
Yeah. And those guys, Ronan Levy and the rest of the team over at Field Trip, they're all ex cannabis guys. So,
oh, okay.
Yeah, the crossover between the cannabis industry and the psychedelics industry is kind of interesting. There's a lot of like guys that struck it rich in cannabis that now are sort of looking at psychedelics as like the next wave. And they're like, oh, we're going to get rich off of this too. And I actually think that cannabis and psychedelics are very interested. You know, I'm personally not like a huge cannabis user. I didn't get involved in the cannabis industry in any way. Like I didn't buy any stocks in cannabis companies or like make YouTube videos about cannabis. I just kind of always thought that like cannabis, it's like a plant. No one's going to turn it into a pharmaceutical. Like you fucking roll it up, you smoke the joint, you take the edible, but I just didn't feel like there were like a lot of like huge business opportunities around it. But I feel like psychedelics are very different. There's so many differences that make between the substances. So for one, like we looked at that book Peak Hall where Shulgin had like his list of like, you know, hundreds of molecules that were all psychedelic. No one's really been able to replicate that with cannabis. Like no one's out there writing the book about like synthetic cannabis derivatives that they cooked up in a lab. It just, cannabis is such a complicated compound that people have had a very hard time modifying it or creating like synthetic derivatives that do anything. Psychedelics are very simple molecules and people are creating new versions of them all the time. And then at the same time, you don't need that like integration component. Like if you're smoking weed for pain relief, it doesn't matter if you're doing it with a therapist, you can just do it on your couch and like the pain relief will come, you know? Mm-hmm. So, yeah, like no one's created cannabis clinics because you don't really need them.
Yeah, right.
Although I am looking forward to the day where they offer like, I think in Las Vegas, they're going to start having like cannabis venues where you're allowed to like smoke cannabis inside and they're going to like have a cannabis menu and you'll like maybe have food or maybe like a live performer or something like that. I think that's kind of cool.
Yeah, like a cafe or something. That'll be a thing. It's just like not yet for some reason, but it'll definitely be a thing in the future.
Yeah. And that's one of the things that I'm kind of concerned about is like we see with cannabis, they legalized it, but they put so many fucking laws on it. Like you can't create like a cannabis bar, you know, a place where like you have a food menu and a cannabis menu. Like that's not allowed. Why the fuck not? Like, why can't we have that? And, you know, one of my fears is that these efforts to legalize psilocybin will end up with similar silly restrictions that just, you know, kind of like cock block the whole thing.
Yeah, true that.
Yeah. And we other things like happen with cannabis, you know, in certain cities where it's like, you can't operate a dispensary within like 1,000 feet of like, you know, a school or like a public park. They have all these like restrictions on like where you can have it and how you can do it and this and that. And just restrictions and regulations that really kill the businesses. So hopefully my goal is that when/if this stuff is legalized, it's legalized in the most simple way possible. You know, it shouldn't have additional taxes. It shouldn't have like, it should just be a thing that you can like walk into, you know, a drugstore and buy.
Yeah. Yeah. We'll see.
It's the hope.
That's the hope. I watched your interview with the dude that's involved with MindMed. I forget his name.
Bruce Linton.
Bruce Lipton?
Linton, yeah.
Bruce Linton.
Linton, yeah.
And he said one thing that stuck out to me, and it was because that this industry is a huge there's a huge what's the word? Regulatory advantage or something like that, is because of the regulations that are on
arbitrage. Regulatory arbitrage, yeah.
Regulatory arbitrage. And it's because you can probably explain it a little better than I can, so I'll let you explain that.
Well, the idea is simple. It's like when you're looking at making some sort of financial trade, like what is the reason for the market generally just doesn't give you opportunities to make money, right? Like usually there has to be a reason. It's not like there's a lot of free money sitting everywhere. So if you see an opportunity, you got to ask like, well, why is the opportunity there? And in the case of cannabis and in the case of psychedelics, the opportunity is there because of stupid laws. Like there were laws that made cannabis illegal. The laws are changing. And so there's an opportunity to make money. Same thing with psychedelics. Yeah. So it's a financial transaction that is possible because of changing laws. That's basically it. Yeah. And these sorts of things are very limited, right? Like there's only so many things that are illegal that people like that are going to be made legal in our lifetime. So
Yeah,
You know,
exactly.
there's not going to, like, 20 years from now, the psychedelics boom will have happened and you won't be able to get involved in it at the
Yeah.
same level that you can now.
And I don't see anything else really being like that, man. Like this, I feel like it's a once in a lifetime offer. Like if you have capital to put into something right now, you're like, if someone asked me like, Gary, I got $10,000, what should I put it in? I'd be like, well, I know a few companies, but I'm gonna have to explain myself a little bit on on where the world's going, because you have to have a little bit of foresight on what these things do. And if you do, you know exactly where the world's going to go and like how beneficial and how much these things are going to be incorporated into our world. So yes, there is a huge regulatory arbitrage about this industry, man. It's
Yeah.
crazy.
Yeah. And I mean, obviously, you know, the opportunity is big. With that comes a lot of risk. You know, many of these companies will fail. That's just what it's like in the beginning
Yeah.
of any industry like this. So it's risky. I mean, you certainly should, if you only have $10,000, you should certainly not put that whole $10,000 into psychedelics. But you might be foolish to like not put some of it in.
Yeah.
And I think that you should, broadly diversify across like lots of different companies. Going all in on one company is probably kind of silly, even if you really believe in them. Or find a good manager that will help you, pick and choose the right ones. And that's
providing the disclaimer to my financial advice.
Dude, I mean, I worked in finance, man. It's all when you work in finance long enough, you like sort of learn to talk about the risk first. Like, you always like pay attention to the downside first. And then you talk about the upside later. Yeah. And that's why, so like in the fund that I'm starting, first of all, we're not going to be investing in publicly traded stocks. We're going to be looking at like startups that are not public yet. But that fund, it's going to spread its money out over, probably 15, 20, 25 different companies, with the expectation that no matter how much research we do on them, no matter how much due diligence we do, and no matter how thoroughly we research the backgrounds of the team members in the business, we still expect, a good chunk of those businesses that we invest in to like fail entirely. But we think that like a couple of them will likely succeed to such a level and like that it will, make up for the failures of the ones that didn't make it. That's just kind of how this sort of thing works. Yeah. When you're investing in like traditional blue chip big companies, Apple, Facebook, Google, that sort of thing, none of those companies are going to fail anytime soon, and they're all going to sort of have like average returns. Maybe some of them will do better than others, but when you're looking at an industry like psychedelics, or when you're looking at startups in general, it's not like that. It's not like they all sort of work together and like, but then some of them do better than others. It's more like 80% of them like go to zero, and then a couple of them go up like a couple 1,000%. That's just kind of how it works.
Yeah. High risk, high reward.
High risk, high reward, and that's why you want to spread it out and be very selective about where you put your money. That's for sure. One of the things that makes me kind of sad about this is like, we talked about the downsides of capitalism when we talked about Compass Pathways patents, but there's this other downside, which is like a lot of people that are just sort of riding the hype train, and people that are like starting up like psychedelic companies that they basically have like a PowerPoint presentation and a bank account. And like they say, they don't have like a qualified research team. They don't have all the things that you would want in a good psychedelic company. Yet, because they have the word like psychedelic in their name and their logo looks like a mushroom, they're able to raise like billions of dollars. And all those investors are just going to end up holding the bag and getting fucked. So, buyer beware.
Yeah, that's the name of the game. That is crazy though.
It is. It is crazy.
Yeah, it's because it's still so early, so anybody can do that if they really wanted to, right?
Yeah, it's early, and so no one knows who the winners in the space are going to be yet. And then at the same time, there's this weird thing about Canadian companies. Like, I love all my Canadian friends, but Canada has I would say that the securities laws in Canada are much more lax than those in the US. And Canada also has much more lax laws around substances like psychedelics. So it's very easy to create a company and have it go public on the Canadian stock market, which is where a lot of these psychedelic companies are going public. It's really weird, man. Like do you know what an RTO is?
No.
All right. So generally you hear about IPOs, which is where companies go public in the US. In Canada, they have this thing called a RTO, which is a reverse takeover, which basically, instead of going public, you just buy an existing public company. and then all of a sudden you're public because you just bought this company. Now you might be asking like, well, how the fuck do you buy a existing public company? They must be very expensive. And they are, but not in Canada, because in Canada, they have so much like mining and natural resources up there. There are tons of companies that raise money in Canada to go and like look for gold in like the mountains up there, and they don't find any gold and then they go bankrupt. And so there's just like a company that literally doesn't have any employees, that is just like a legal entity that is like publicly traded, that's like a dead company. You can buy one of these fucking dead companies for like $100,000 and all of a sudden you have a publicly traded company. And then you can pump your stock, you can make a fake press release, you can go on a couple podcasts, and all of a sudden people are promoting your stock, and then you sell it. Yeah, it's just like it's like the perfect shitstorm for weird, like manipulative financial fuckery. And people are kind of doing it all on the hype wave of psychedelics, which is really sad. And I'm hoping that sort of thing will sort of fizzle out as the industry matures. That's why we're not going to be, another one of the reasons that we're not really going to be looking at too many publicly traded companies and focusing on startups in the US with like good teams and good backgrounds.
Yeah. So can we get into your what is it? What was your actual title for your company? The venture fund?
Oh yeah. So the venture capital fund, it's called Empath Ventures. That's the name of it. Wanted to have something that was sort of related to the mental health stuff.
I like it.
If you're an accredited investor and you're interested, you can go to empath.vc, empath.vc. There's like a contact form there. Fill it out. I'll hit you up, provide you some info on the fund, or you can like DM me on Twitter at the real Brom, whatever. I'm everywhere online. You can find me. And the podcast is called The Integration Conversation. So even if you're not someone who can invest in the fund, you can still listen to the podcast and hear conversations about psychedelic business with, all the cool people in the psychedelics industry.
That's cool, man. What is your goal with the, are you going to act as almost like a broker? Like, are you going to be?
It's not really, so it's not really broker, dude. The way that it works with venture is like, I raise money from the investors, right? Then I have like this pool of money. And then the goal is I go out and I find like the coolest startups on the planet that are doing stuff with psychedelics. And I help, and I, give some of that money to them in exchange for equity in their company. So not a broker, it's more like an investment manager. Okay. So that was kind of one of the amazing things that started happening, because this podcast is like, even before I had the idea to start a fund, I literally had like the CEOs of psychedelic startups hitting me up on Twitter and LinkedIn, like, hey man, I love your podcast. We're trying to raise like $10 million for this like psychedelic research company. Can you help us? And I was like, shit, like people are, and then I also had like rich investors that were DMing me on Twitter that were like, dude, do you know any like cool startups that I should invest in? And so before I even opened the fund, I was literally matchmaking like angel investors and psychedelic startups. And I, had, significant chunks of money like invested into some psychedelic startups just because of people that messaged me because of the podcast, which is kind of crazy. Because the podcast isn't that big. It's like, I don't even have like 1,000 subs on YouTube. So just from there, it was like, there was so few people talking about this stuff that I was kind of like the only one, and just had a lot of people reaching out to me. So the goal is to, just keep running the podcast, keep building awareness, and hopefully attracting the potential investors and interesting companies that I can, get some of that money to.
That's awesome.
Yeah.
And it's all for a good cause too,
Yeah. It's something that, when I worked at the hedge fund, like, no disrespect to people that work at hedge funds, I'm still very good friends with a lot of the people that work in the hedge fund space. But like, at the end of the day, when you're like trading these, like, you're trading in the public markets, you're not really like having an impact on the companies. You're just like buying their stock one day, selling it the next day. It's like, dude, what am I like really building here? Yeah. And the answer was like, not much. I tried to justify it to myself in a lot of different ways. And eventually, I realized that like I was basically making money for our investors and for myself, which like money is great, but I wasn't really building anything. But at least when you're working with like startups and you're working with like venture capital, it's like you're helping a startup raise money, and without them getting that money, they like will not exist in like 6 months. You know what I mean? It's like you're helping get like a new idea, a new promising research direction, a new product that will help get psilocybin to people. You're like enabling that thing to come into existence.
Yeah, that's cool, man.
Yeah. So to me, it's like still maybe not as meaningful as like building an interesting product yourself, but at least you're like actually like causing some things to happen. And then you can also in the private investor world, you can also do interesting things like if one of the companies you've invested in is like in trouble or needs to hire a person and you know a person, you can like refer them. It's like you're much more involved in sort of, the day to day, and you can kind of have some impact on what's happening, which is kind of cool.
Yeah, definitely. That's
Yeah,
awesome.
that's the goal.
So what is your personal experience with psychedelics? Like what did you get from it? What have you don't have to talk about how many
No,
times
no,
you
no. I'll
tripped.
talk. I'll talk about it.
All right.
Dude. So the first substance I ever did was, let's say the first substance I hypothetically ever did was LSD, and I had been, dude. It took me a long time to do it. Like I told you that I heard about it first from like my cousin, and then I read a bunch of books. Like I don't know if you know who Sam Harris is, but I was like big into Sam Harris for a while. I was raised in like a very sort of Christian environment, and so I was like going through the atheism phase and all that. And then I think it was Sam Harris's book that he mentioned psychedelics as like a gateway to spirituality without being religious, which kind of like pushed me over the edge and made me decide to actually like try it. And so, I ended up procuring this substance and doing it totally by myself. Like I didn't do it with friends. I didn't like go out in the woods. I was at the house I lived at, and I just did it by myself. And we had like a little, there was sort of like a little deck on the second story of the house. It was a house that I lived with roommates. It wasn't my own place, but this is back in South Florida where I used to live. And dude, I straight up just took this LSD and laid on like the deck roof of this house thing. And, there are a lot of things that happen. It's never just one thing, but I remember, having this sense of like extreme empathy for people in my life that I had previously had like very cold feelings for. And people that like I had just never thought that I could like think of in a positive light. And I just remember sort of having these sort of like scenes play in my mind of like, here are interactions that you've had with these people. Here's what it could look like. I felt like I had like almost like lived their lives in a way and understood why they were the way they were, that sort of thing,
Wow, that's powerful.
Yeah, it was super powerful, man. I did a pretty powerful dose. It wasn't, I at that point in my life, I was very much into like, if I'm going to do something, I'm going to go all the way. So I went in pretty hardcore. And yeah, it was super powerful, super intense. And so that was, I would say that prior to doing that, I certainly was like hardcore, almost like edgy internet atheist energy. And I still would consider myself like an atheist, but it certainly opened my mind to the possibility that like there's just, or at least to the fact that there's a lot of shit that we don't understand,
Exactly. Yeah, exactly.
Yeah. So that was kind of like the first trip. And then I remember, let's see, I certainly had like some fun psychedelic experiences as well after that, at festivals, and that sort of thing. But I have like known lots of people. I would say, it's kind of, I wasn't really prepped to like talk about this. So let me think this through a little bit. I didn't really grow up or have like a friend group that was like super into psychedelics. So when I started like dipping my toes into this water, most of the people that I knew were like, dude, you're fucking insane. I'm kind of amazed that you're doing this. Like, I was like the one guy in the group of friends that was doing this. And so I was almost like the advocate, and it was really interesting to watch people that I knew that had never done this stuff after many conversations with me. And I never tried to push anyone to do it. I would just like tell them my experiences. And if they decided that they wanted to do it, I would sort of like help them figure out how to do it. And to see these people sort of like totally change and to hear their stories. Like one of the more interesting stories, it's pretty simple, but like there's this guy that I had been talking to it about for a while. He was a guy that worked in finance. And, you hear a lot of stories about psychedelics. Like you hear about like, people will say like, oh dude, Steve Jobs, like he invented the iPhone while he was on LSD. You like hear that all the time. And like, obviously that's not totally true. He did say that it provided inspiration, but people hear that kind of shit. and they're like, oh dude, I should do psychedelics because it's going to give me like an edge at work. You know what I mean? Or they're like, it's going to help me like do whatever. So this guy, finance guy, he's telling me how he's going to do psychedelics and how it's going to hopefully like give him new ideas for his business and shit. And so he does the psychedelics. And the next time I talk to him, I'm like, so how did it go, man? And he's like, he looked like totally humbled and everything. And he's like, you know, I went into it thinking that I was going to have all these insights into like how to be better at my business. And I just realized I came out of it just thinking about how much I need to love my daughter. Like that was like what he got out of it, you know? And so it's cool seeing this stuff even done outside of like that proper therapeutic context, really sort of recenter people and help maybe people realize like what's important, which is pretty cool. And one of the nice things about like being involved in sort of the psychedelic industry is obviously there are a lot of sharks and bullshitters out there, but a lot of the people that I've interacted with, maybe they're just really good bullshitters, but they seem to genuinely care about what's important. Whereas you look at more traditional industries and people are just like so fucking cutthroat and, you know, zero sum and don't want to be collaborative, where I feel like the people in this industry, most of whom have had psychedelic experiences, are not like that, which I think is like really cool.
Yeah. Right.
Yeah.
Definitely different.
Yeah.
That's awesome.
Yeah. I'm trying to think of like other interesting things that psychedelics have like done for me. I don't know. I would say, you know, I always push myself pretty hard, like academically and professionally. Like when I was working at these 2 different hedge funds, and at the same time I did a master's degree, like while working full time. And then I also did this thing called the CFA program, which for those of you who are into finance know, it's like a very, very hard financial certification. And I did both of those things while working full time at a hedge fund, which hedge fund jobs are pretty tough. And, you know, I think that like, if I hadn't done psychedelics, you know, once or twice a year, I would generally do like a large dose of psilocybin mushrooms. I would have gone like, I would have totally fucking lost it, man. It was just like such a it was such a high pressure situation. That I think that like the psychedelics really helped me keep things in perspective and help keep me from going too off the rails, you know, although I'm sure those who knew me at that time would know that I was always a little off the rails, but it kept me kind of like, you know, in line with what needed to happen. It's amazing how like psychedelics will almost just like talk to you in a weird way. Like you always go in with thinking like, oh, this is what I want to get out of the experience. And then you get something else out of it. Like I remember one of the more recent times, it was like I just spent like 30 minutes being told by the mushrooms that I needed to fucking stand up like more straight and not like slouch over. It was like, dude, relax and stand up straight, man. Just like, what are you doing to your back, hunched over in front of the computer? Like, what the fuck, man? Go for a walk, dude. Yeah.
Yeah, they're teachers.
They are the teachers for sure.
Do you think it's like really enables us? Thing. Yeah, man. Do you think it enables us to like tap into our subconscious mind? You know, or is it like, do you think you're actually kind of reaching some kind of telepathy with another intelligence? Like when you say you're talking to the mushrooms, you know, yeah, you know, it's hard to say, but I know what you mean.
I mean, I love the idea that it's allowing us to communicate with some other entity. You know, as like a atheist kind of like materialist thing, I think that like until someone can prove that that's the case, I think it's most likely just that we are tapping into things in our mind that have been hidden away, you know. The science shows that, and of course I'm not a scientist, so I'm sure someone who actually knows what the fuck they're talking about will correct me, but like increased neural connections, so parts of our brain that are normally not talking to each other now begin talking to each other. This is what we see when we put people in MRI machines and give them psilocybin. And so, yeah, I think that a lot of that knowledge, we don't have to talk to a fucking alien because it's already in us. We just can't access it, you know? Yeah. And, yeah. And I don't know, man. So a lot of the, and this, another reason why I think it's not necessarily alien intelligence or like some other being is just because so many of the lessons are just like so simple, dude. It's like, love your daughter, stand up. You know what I mean? Like they're not giving us plans to do some sort of complicated thing or whatever. It's just like, be a better person.
Yeah.
Have empathy for those people that hurt you. You know, these are like lessons that we learn in like our childhood, like storybooks. You know, they're not necessarily things that we need to like go to. They're just, those lessons are not shown to us in such an intense way when we're kids. Like they're shown to us through psychedelics in like this very intense way where they're almost undeniable.
Yeah, I know what you mean. Yeah, they're
Yeah.
not telling us how to build like an anti-gravity machine,
Right.
something
I mean,
like that.
maybe I just haven't done a high enough dose yet. Maybe that's the secret. I mean, what about you? Like, what things have you learned from your psychedelic experience? Like, would you say that psychedelics have altered the course of your life?
Oh, for sure.
Yeah.
100%. Yeah, I mean, what you said was pretty much what I would say is it shows you what's most important, and it shows you that we don't know really what's going on, or at least we think we know what's going on, but for sure when you take these high doses, it's like, whoa, we have no idea
Yeah.
what's really going on. It shows you that there's so much more out there than we think we know. But our little monkey minds think we got it all figured out because we have Google and Wikipedia. But
Mhm.
no, there's significant amount more that we can tap into from these things, and they allow us to tap into. I agree with you that they allow us to tap in more into our being, like just more maybe these synapses allow they we can connect neural pathways that weren't able to connect before because of these substances, and yeah, that's pretty much. I mean, for me, I was also in a dark place. I was not feeling so good about life. And then I found some psilocybin mushrooms, took a large dose one time, and it showed me like, whoa, man, you gotta like take a whole 180 in how you view your life. And I did. And ever since that day, it never really left me. It was a mystical experience that never really, it's not something that I can just shut off and be like, oh, whatever, that was just I'm not gonna think about that again. It was probably the most amazing experience in my life, or at least one of the most amazing experiences in my life. And I was just sitting in my bed by myself, just simply experiencing the chemical effects of psilocybin. And it's not. People get confused too. They're like, oh, you're just chasing an experience, just chasing high. No, it's not like that, because it's like, yeah, you go through these mystical experiences, you go through this journey of the mind, I guess you could say, and it provides you with lessons. Like, even though like some people do it for the colors and they want to see elephants and the dragons, but if you do it in the right way and you integrate it in the right way, it'll provide you with the experience, yes, but from that experience, if you look at it in the right way, it'll allow you to look at yourself in the right way, and thus from there you change. At least for me, that's I changed. I those the things that the mushroom showed me um, allowed me to learn things that I never really allowed me to, like, as Terence McKenna says, dissolve boundaries within myself. It allowed me to like kind of like break down some walls of depression, anxiety that I had, that they always come back, they always creep back in. We live in the 21st century Western world, but there it because I dissolved those boundaries that night and saw myself for what I really am, and saw the people in my life, and what it really means to be a human being, and had some things come over me and feel some type of way that I never really felt. It's something that you can't take away from me. It's like it's something that filled some void that is forever in the back of my mind. And for that, I am forever grateful for these substances, and I know how powerful they can be to all these people, millions. I don't know about, well, I'll say, yeah, millions of people,
Millions.
millions of people that are suffering all over the country, all over the world. I know how beneficial it can be. Not necessarily all of those people, but it can definitely help many of those people in the same way that it helped me. So because of that experience and other experiences as well that I've had, I'm making it kind of one of my life goals to spread the good word about it, because I think every person counts. I'm not the most articulate person in the world, so that's why I started this platform to speak to other people that are more articulate than I am, a little more intelligent, a little more education. Um, and yeah, that's kind of where it shifted my life, because I have to, like, I feel like I'm doing myself in the world a disservice by having I would be doing myself a disservice if by having that experience and then just walking away from it like it was nothing, you know?
Yeah. If you have an experience that truly helps you and it could help others and you don't share with them, you're kind of an asshole. So I mean, yeah, you're totally right.
Yeah.
Yeah, and I think that we see this with so many people, right? They do psychedelics, and many people have a hard time just like walking away from it. It's such an impactful thing. There have been lots of different studies done where they gave people psychedelics and then said like 5 years later, they go back and ask them like, what write down like the most impactful experiences of your life. And like most people will include, psychedelics in like the top two or three. I would certainly include that up there in the top experiences of my life, at least in terms of like intensity and impact. And you're right, man. It like makes such an impression on you. It's so hard to forget. And like you can forget, but you can't forget forever. You can like shove it down, but like it will come back. And if you want to, if you have the right intentions, you can access the memory of like what it felt like to, be surrounded by like the warmth and love that the psilocybin teachers or the 5-HT2A agonists, whichever way you want to believe in it, gave you, because it truly is like a beautiful thing. You were talking about the amount of people that it can help. Dude, 20% of people are currently diagnosed with some sort of mental issue. And, there are like 7 billion people on the planet. So we're talking like over 1 billion people
so that's 20% in the world.
That's actually, I think that's a US stat, but I would imagine that it generalizes pretty well across the US, right? Even if they're not necessarily diagnosed, I'm sure they're struggling with some shit. And dude, think about like, for all the problems in the US, think about how bad other parts of the world have it.
Yeah, for sure.
Lots of trauma. If you live in like a war-torn country, a country where starvation is the norm, that's like a shit ton of trauma. And, I don't know that psychedelics is the number one thing that these people need. Like they might need like food and water first, but like at a certain point, they're going to need, some healing from those experiences. So yeah, I think a lot of people on the planet can benefit from this stuff for sure. And dude, I mean, I'm kind of in the same boat as you. Like I told you, I left my job last year, not really sure what I was going to do. And it's like, I made a list of things and it's like psychedelics is the thing that it's interesting to me. And it also has like more impact than anything else I feel like I could really be doing. Right. So it's the future. And one of the other things that I think is kind of interesting that you touched on is like, we don't really understand what is happening with the brain. And when I've talked to a lot of these like pharmaceutical CEO guys, they've sort of pointed out that over the last like 20 to 30 years, funding for like basic research on the brain in terms of like drugs has kind of like dried up. Like people are focused on making cancer drugs and other things that are very important, but they kind of like stopped really focusing on the brain because they were having a hard time like making breakthroughs and understanding the brain. And I think that this wave of psychedelics, like in the long run, I don't think it's really about psychedelics as much as it is about like, here's a renewed interest in truly understanding how our brains work, how different chemicals affect the brain, and like, where does consciousness come from and how can we alter it for our benefit, And I think that that's what excites me the most. It's like, it's much more than just like eating a mushroom, it's like, this is the beginning of an era of like truly understanding and hacking our brains.
Yeah, right.
Which is like fucking insane.
Yeah, right. We were talking about, I mean, yeah, we can go down that avenue if you want, because this whole conversation was about like, how it was going to be incorporated in our society and the mental health aspects and, healing PTSD and things such as that. But yeah, really diving into what the experience shows you as a conscious being, that's a whole other avenue, man. That's like a whole other aspect to what these things are. Like actually, because like once you do it, once you're in that experience, like if we were both on mushrooms right now, we'd be like, dude, this is crazy. Like, what is this? You know what I mean? It's like, once you do it, you can't really take it back. Once you go through that experience, it's something that's like, wait, what was that? It's like, you can't help but talk about it. Like, I can't help but talk about that. There's something in me where like, I have to. That was one of the most amazing things that ever happened to me. And the only conclusion you can come to, at least I can come to, is that we have no idea. There is so much that we don't know about what it means to just be alive, simply, And these psychedelics, I don't know if they give us glimpses into how much we don't know, or maybe give us a glimpse into, I don't know. Nobody really knows, but they show you certain things. They show us things about our mind. That's what's cool about it,
Yeah. One of the things that I'm super curious to see is like, obviously treating depression and anxiety is good, but many people have had experiences where they do psychedelics once and like the next thing you know, they're like quitting their jobs because they're like sick of being a cog in the machine, and they like
Yeah.
decide they're going to be a painter, or they're going to like pursue that thing they always wanted to do, whatever. And I wonder, like, if you do psychedelics in a clinical setting under the care of a therapist, like with, a clinical integration, does that stuff still happen? Like, are we about to enter another era of like people, refuse? We're already sort of seeing people refusing to be parts of like the capitalist machine, and this like whole COVID thing, where people are quitting their jobs because they don't want to go back to the office. They don't want to commute. They're like sick of their fucking jobs. Right. And I wonder if like more people having psychedelic experience is actually going to accelerate that trend. And, I don't know. I think it remains to be seen. I think that like, no matter, I've never done psychedelics in like a clinical setting, but I've got to believe that no matter how clinical the setting is, you're still going to have the same feelings. And if you're in a job that you don't like, it's going to be hard to like go back to that job after doing your psychedelic drugs, whether they're from a pharmacy or whether they're from your local mushroom grower,
Yeah, I think so.
Yeah. And then of course, imagine like, do people start voting different politically? I think that's an open question. And then you've got the downsides too, man. Like, how many people have you met that do psychedelics and suddenly think that they're fucking Jesus and become a giant asshole? There's that downside too.
Mm-hmm.
It does.
Yeah. I think
it's an interesting time to be alive for sure.
That's for sure. Yeah. To sum it up, it really is. With the right integration, I don't think you'll get the Messiah complex, but who knows? Everybody's different. So it's hard to say.
Right. Yeah. That guy that was wearing the Viking outfit that stormed the Capitol was like huge into psychedelics. He posted about psychedelics all the time on like his Facebook page and stuff. He was like very into them. I'm guessing that guy didn't have the best integration work.
Yeah, what was the something shaman? Didn't they call him something like that?
The QAnon shaman. Yeah.
The QAnon shaman. That's awesome. Wow.
Yeah.
Yeah. What a time to be alive, man. That's for
sure.
Well, we could probably wrap this thing up. You got any closing statements that you want to tell the world?
Psychedelics are, this massive, man, it's, fuck, I've been talking for so long. It's hard to like keep talking. Dude, so the psychedelic revolution is here, man. And whether you want to participate in it as a consumer or as an investor, that's your choice. But I think it's something that you got to be aware of. I appreciate you, letting me sort of share what I'm up to on this podcast, man. I'm going to plug my stuff if you don't mind. So my podcast is The Integration Conversation. You can find it on YouTube. You can find it on Spotify, anywhere podcasts are sold. If you're interested in getting involved in my venture capital fund, it's called Empath Ventures. Go to www.empath.vc, and there are ways to contact me on there. And I'm more than happy to, talk about what I'm seeing in the psychedelic startup space and all the interesting investment opportunities that are out there. But yeah, that's pretty much it. I think, and everyone should, if you're watching this, you should obviously subscribe to The Conscious Perspective. Like, if you're not subscribed, what the fuck are you doing, man? Subscribe.
Yes. What are you doing?
Subscribe to this channel, subscribe to my channel, and, motivate us to keep this content coming.
100%, especially if you made it this far, man. Like, come on.
For sure. If you listen to the end and you're not subscribed, Jesus Christ.
Yeah, man, this was a great convo. I think we covered a lot. I learned a lot. Hopefully anybody that listened learned a lot. And yeah, man, you're pretty much covering the psychedelic revolution. I mean, we both are, just in different ways, but you're in the trenches, man, covering like what's actually going on with these businesses. So it's pretty cool.
Yeah.
So yeah.
Well, I'll maybe in a couple months or a year, I'll come back with some updates and let you know how it's unfolding.
Oh, for sure. 100%. You're always welcome on. This
Thank you,
was a cool
sir.
convo. Yeah,
you have a good rest of the night. I appreciate
Keep doing
that.
your thing, and peace out, man.
Peace out, dude. Talk to you later.